You may recently have had surgery or about to go through surgery, so we have put this information together to help. In the following presentation, you will see real patients changing their stoma bags to give you an insight of what's involved.
My name is June Dale and I've had my stoma for 11 months.
My name's Geraldine and I've had my stoma for almost 2 years now.
My name is Julian and I've had my stoma just over 4 years.
My name is Pauline and I've had a stoma 3 years.
My name's Raymond Denyer and at the operation January 21st, 97.
I had quite a serious bowel cancer and I was taken into hospital and they told me that the best thing to do would be to have the tumour removed and have a total colostomy.
Just over 2 years ago they decided that I had to have my back passage removed, so I ended up with a colostomy.
Well, I had bowel cancer detected and that was the reason given for the necessary bag.
I thought it was very, very neat. Obviously I didn't know what to expect because you come round from surgery with a bag in place.
I vaguely knew what was going to happen to me and how it was going to look, and actually mine's quite small and looks like a rose.
You will need to think carefully and logically about what you're going to do. For example, when you take off the bag, where are you going to put it? A disposal bag is the most convenient way, so get that ready. This bag can be sealed and safely disposed of in your domestic rubbish. The hole cut in the flange should fit closely around the stoma. This should be checked at regular intervals.
When everything is laid out, I use my spray to release the adhesive on the bag. That releases the bag down over the stoma, which then comes off. Put it in a disposable bag. We have wipes, so I use quite a few of those, which I tear in half because they're quite big, and clean the stoma up, put the wipes in the bag. Once the stoma is completely clean, I like to make sure the skin is dry. Remove the label off of the big round circle off the stoma bag, put it over your stoma, making sure there's a very good adhesion and it's sealed all the way around and it's complete. And then wash your hands afterwards.
I spray onto the bag around the edges. I then slowly peel it away and I then get a wipe and I wipe round, and I particularly wipe the edges around the outside where the new bag is going to be placed, and I clean up carefully round the stoma itself. And I then use one more wipe to just make sure it's absolutely dry, and then I replace it with a new bag.
Some patients do not feel comfortable disposing of a full bag without emptying it. An alternative method is demonstrated by Pauline.
I will cut the bag across the top. I open this out, rinse this out, put the top bit in the bag, attach the waste and empty the bag. Put it in there.
Some companies offer a flushable alternative. Please speak to your stoma care nurse for further details. Some patients experience reddening of the skin on removal of the bag. This is not unusual and will quickly disappear. Stomas are as individual as the people who have them. Don't worry if yours does not look like this, as long as it's pink and functional. It's not unusual to have a bit of blood from the edge of the stoma. Should you encounter any problems with the care of your stoma, seek advice from your stoma care nurse, who will advise you of the additional products to help. A two-piece system consists of a base plate or flange and a bag. These connect in a variety of ways, which your stoma care nurse will demonstrate. The advantages of a two-piece system are the different bag sizes you can use. For example, a small bag or cap for sports or intimate moments. Another advantage of a two-piece is the base plate can be left in place for up to 3 days, and bags changed as necessary. The removal and cleaning process for a two-piece system is the same as for a one-piece. However, the application process is slightly different, and it is done in 2 stages. The flange is applied first. Then the bag is connected. We have shown you how to change a stoma bag, which will need to be done up to 3 times a day, dependent on what you eat and drink. If you need to change more often than 3 times a day, speak to your stoma care nurse for a more appropriate bag. Irrigation and use of a plug are an option. Please ask your stoma care nurse for details.
Got quite used to it now, bathing and bath. It hasn't altered my lifestyle really, much at all.
Once you've got it, your life's going to be considerably easier. You will be checked regularly, and although you're going to have some teething problems at the start of this, when you're getting used to it, life does get easier.
I was concerned that my husband would think it ugly and disgusting, but our intimacy has grown. Because, as again, I'm not in any pain, and actually doesn't affect us at all.
I think you'll find that your friends and your family will be very supportive. I run a Sea Scout group which incorporates rowing, camping, lots of physical outside activities, which I've not been restricted with at all.
My life's changed for the better.
Hopefully, seeing it done by real patients with real stomas has given you confidence that it is a straightforward process. It may be daunting at first, but in time you will become the expert. Should you experience any problems, please be assured there is advice and help from your stoma care nurse, the various patient support groups and company helplines.